Hi, I'm Dr. Sarah Hurvitz from the University of California, Los Angeles. In hormone receptor positive breast cancer, we have the ability to use therapies that actually target the hormone receptors. In fact, some people would say that the first targeted therapy for any cancer was hormonal therapy. If you remove a person's ovaries, if they're premenopausal, you cut off the supply of estrogen. And that, in effect, is a way of depriving cancer cells that have hormone receptors from surviving. This was a technique employed for many years, beginning in the late 1800s. However, in the 1900s, it was discovered that drugs or therapies could be given to patients, such as tamoxifen, which block the estrogen receptor. So instead of having a woman's ovaries removed, she could take a pill to block the action of estrogen on the estrogen receptor. We know that about two-thirds to three-quarters of breast cancers are characterized by the presence of estrogen receptors and or progesterone receptors, collectively called the hormone receptors. While tamoxifen was the most commonly used pill to block action of estrogen, in the 1990s and early 2000s, a class of medicines called aromatase inhibitors were developed. These are pills that block production of estrogen in a woman whose ovaries are no longer functioning, so a postmenopausal woman. These drugs block the conversion of fat and testosterone into estrogen. And so a postmenopausal woman has the option of taking this pill instead of tamoxifen to block the estrogen from feeding cancer cells that have estrogen receptors. A number of clinical trials were conducted comparing aromatase inhibitors to tamoxifen and showed that aromatase inhibitors are a little bit better at preventing breast cancer from progressing or preventing breast cancer from recurring than tamoxifen. So they've become the preferred agent for women who are in menopause. More recently, trials have been done in premenopausal women showing that aromatase inhibitors can be used and are effective when given in combination with an injection that turns off the ovaries from producing estrogen. So these are therapies now that we have available that are standard of care therapies for all stages of breast cancer that are hormone receptor positive. In the metastatic setting, we also have an agent called fulvestrant, which is an injection that, like tamoxifen, blocks the estrogen receptor, but also downregulates the estrogen receptor, so reduces expression of the estrogen receptor in cancer cells. And a number of trials are ongoing now looking at oral formulations of this type of drug called a SERD.